Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, I will share with you the Health Emergency Operating Committee's situation report. On May 19, 2021, we identified the first COVID-19 case in this second wave of COVID-19 infections. Over this past 3 months, we added 585 COVID-19 cases to our tally. Over these 12 weeks, we have noted 533 recoveries, and at present, we are monitoring 49 active cases. There are 2 COVID-19 cases admitted at the COVID-19 ward, JNF General Hospital. This slide shows the epidemiological curve, and as you can see, we are at the tail end. The number of COVID-19 cases is on the decline. In fact, our daily case counts are in single digits. At present, we reported a total of 630 COVID-19 cases, with 22 cases identified in Nevis and a total of 608 cases identified in St. Kitts. As I said before, we've had a total, that is between last year and present, a total of 578 recoveries. We are monitoring 49 active cases, and so far only 3 COVID-19 related deaths. This afternoon, I want to report that we have successfully contained the COVID-19 outbreak in the prison system. And so earlier during this wave, we identified a total of 56 inmates who were diagnosed with COVID. They have all recovered, and a total of 18 staff members or prison officers were diagnosed with COVID, and they have all recovered. And I want to update the public that at present, no visiting is allowed at the prison. Now, in terms of our vaccine program, at end of work day yesterday, we administered a total of 43,966 vaccine doses. And in terms of the coverage rate, so far we've achieved a coverage rate of 72.5% of the target population covered with the first dose of the vaccine, and 60.5% of the target population fully vaccinated. More specifically, a total of 20,000 persons in the Federation would have received 2 doses, or they are fully vaccinated. In terms of the vaccine program, let me just break it down a little further. The target population refers to the adults in the population, those 18 years and over. And based on the last census, approximately 33,037 persons comprise the adults in the population. And so in terms of the first dose coverage, 23,966 would have received a first dose, and 20,000 persons would have already received 2 doses, or they are fully vaccinated. So at present, we have approximately 9,000, a minimum of 9,000 adults remaining to come on board in terms of accepting the COVID-19 vaccine. Again, this data is based on the last census conducted in 2011. Now, at present, we have a batch of AstraZeneca Oxford vaccine. Now, this current batch expires at the end of August, the end of this month, August 31st. Now, persons who received their first dose of vaccine between June the 3rd to June the 30th, we recommend that you return now or within the month of August for your second dose. Now, during the month of June, once you got your first dose, towards the end of the first week to the end of June, you were given a 12-week appointment because we weren't sure when we would receive the current batch that we have in hand. And so please note that the recommended interval between the two doses is anywhere between 4 weeks or 1 month to 12 weeks. Now, please note also that the World Health Organization recommends that you can receive that second dose anywhere between 8 to 12 weeks after the first dose, and you would achieve an acceptable efficacy level. And so those who would have received their first dose around about June 9th, 9 weeks have already elapsed between your receiving the first dose and present. So in other words, you can come and you can return for your second dose anytime now. Those persons who received their first dose during the second week of June, 8 weeks have already elapsed, and so it is safe for you to return now for your second dose. So I repeat, persons who would have received their first AstraZeneca Oxford dose in the month of June, we recommend that you return anytime now to receive your second dose. Again, this current batch of vaccine expires on August 31st. I want to just comment a little bit about COVID-19 vaccine and pregnancy. Pregnant women are at an increased risk of getting severely ill from COVID-19 and can indeed experience adverse pregnancy outcomes. And so the vaccine, the COVID-19 vaccine, can prevent COVID-19 in pregnancy, and it can help to prevent some of these potential adverse outcomes. And so it's now a recommendation for pregnant women to get vaccinated against COVID-19. So here in the Federation of St. Kitts and Nevis, the COVID-19 vaccine will be administered to a pregnant woman who, upon submission of a letter from the obstetrician and gynecologist granting clearance. So in other words, if you are pregnant and if you visited your obstetrician and gynecologist and if you discussed the whole issue of accepting the COVID-19 vaccine, if you consent and you ask or request a letter from your obstetrician and gynecologist, once you submit this letter to the nurse at any of the health centers, we will administer the vaccine. Our contact tracing, we continue the robust contact tracing process, and up until yesterday, August 10th, a total of 2,799 individuals would have been interviewed, and 2,703 persons were released or have been released from self-quarantine, and we are presently monitoring almost 100 persons who remain in self-quarantine. So yes, we continue the contact tracing process. We continue testing individuals who present with signs and symptoms of COVID-19. Over this past 3 months, we conducted well over 17,492 samples. So in other words, we took well over 17,492 samples, which were processed at our local labs. Okay, so Superintendent Henry touched on the change or the amendments to the health and travel protocols whereby inbound vaccinated passengers are allowed to return to the Federation once they would have submitted a negative RT-PCR test prior or done within 72 hours of travel, they can now qualify for a reduced quarantine period of 4 days. Please note that the exit sample will be taken on the morning of day 4. Again, you have to apply online to have your private residence certified for your quarantine, if that's your wish. Please note the URL, it's covid19.gov.kn. Okay, and so just to underscore that if you qualify for the reduced or the reduction in quarantine, 4-day quarantine, if you are traveling with a child and the child is unvaccinated, the child will be subject to the same quarantine time as yourself. Now, I just wanted to add this bit of information. So inbound passengers who are fully vaxxed, and if your premises is certified for quarantine and you've been granted approval to serve your quarantine at home in a private facility, you must sign a notice of quarantine form upon arrival at Robert Llewellyn Bratcher International Airport. And this is just a picture of that form. Please also note that your COVID-19 test sample will be taken on the morning of day 4 of your quarantine. Now, there are 3 identified sites in St. Kitts where you can access or get your sample taken. And it's at either of the 3 hospitals. That's the JNF General Hospital, the Parkson Hospital, and the Mary Childs Hospital. The time, 7 a.m. Each morning. So your sample will be taken between 7 and 8 a.m. each morning. No swabs will be taken after 8 a.m. In Nevis, your test sample will be taken at either of 2 locations. The first is the Disaster Management Building, and the second site, the Gingerland Health Center. You are required to use only private transportation to drive to and from the hospital or testing site to have your exit sample taken, and you must wear a face mask and sanitize on this trip. You shall only be released from quarantine after receiving a negative RT-PCR test. I want to spend some time talking a little bit about the Delta variant, which was first identified in India. It is referred to as one of the variants of concern. Please note that it is the most contagious version of the coronavirus or the SARS-CoV-2 virus to date. It is spreading worldwide, and it's now responsible for over 82% of infections diagnosed in the United States of America. I want to share 5 things about this Delta variant. 1, the Delta variant is more contagious than the other virus strains. It is spreading. They've conducted studies and they have found that the Delta variant was spreading 50 times faster than the Alpha variant, which is the variant that was first identified in the United Kingdom towards the end of 2020, and it has been found to be spreading 50 times more than the original strain of the COVID-19 virus. Please note that unvaccinated persons are at risk. So persons who are not fully vaccinated against COVID-19 are at the most risk. Now, the Delta variant can lead to hyperlocal outbreaks. What does this really mean? What they are finding is that in those territories, like in the United Kingdom, the United States, the Delta variant is skipping and jumping from poorly vaccinated areas to other poorly vaccinated areas. Now, there is still more to learn about the Delta variant. And the 5th point, vaccination remains the best protection against this variant. The AstraZeneca Oxford vaccine was 60% effective against symptomatic disease caused by this variant and 93% effective against hospitalization. The Pfizer-BioNTech vaccine was 88% effective against symptomatic disease caused by this variant and 96% effective against hospitalization as a result of this variant. It's just a matter of time before the variant gets here. That is, if it's not already here. Well, let me just pause to share or just to underscore that the last or the latest batch of about 4 or 5 samples were dispatched to the Caribbean Public Health Agency for genomic sequencing round about the 28th of July. So we are not sure as yet, but it's just a matter of time before we identify the Delta variant here. So how can you and I prepare ourselves for this eventuality? Well, we need to adhere to the COVID-19 protective measures, wearing the face mask at all times, maintaining the safe distance of 2 meters between yourselves and others when in public spaces, ensuring that you maintain good hand hygiene and vaccination. If you have not already accepted the vaccine, please consider same. The Delta variant is more than likely going to be the cause of the next surge in the Federation, but we can prepare ourselves and we can mitigate against the consequences. So in the Ministry of Health, we are preparing by strengthening our contact tracing procedures. We are preparing by augmenting our testing capacity. We are preparing by training our staff in terms of the clinical management of COVID-19. We are also preparing by augmenting or improving the COVID-19 vaccines that are being offered to the population. The U.S. government's donation of the Pfizer-BioNTech vaccines to the Caribbean nations was announced today. I saw it in the media. And in St. Kitts and Nevis, we are expecting the first of 3 shipments tomorrow. Now, the shipment we expect will contain approximately 11,700 doses. And the Ministry of Health, we have made all the preparations in terms of receiving these vaccines, appropriate or adequate storage, distribution, and administration of these vaccines. Please note that as far back as March the 22nd, if I'm not mistaken, there was we had universal eligibility in vogue, whereby adults could accept the AstraZeneca Oxford vaccine. Now, in terms of the Pfizer-BioNTech vaccines, anybody or all persons 12 years and above can present and accept the Pfizer-BioNTech vaccine once we announce the date when we would begin or commence administration. Thank you.
Thank you very much, Dr. Laws, for the health presentation.